Hi guys. Hope you all had a good rest last night. Welcome to day 2 of semifinals for Galenoquest'21. I welcome all the faculties of Department of Anatomy on behalf of batch of 2019, as well as the participants from the batch of 2020. So I would like to update the scoreboards. Med Zeppelin, your points is 2,480. Porta Hepatis, 970. Super Scrubs, 4,050. Humorous Guys, 2,030. And Smarticus, 1,135. Trios Abdominis, 780. Triumphant Triads, 3,740. The Craving Remasters, 1,050. Are you all ready for the clinical case round?
Yes, Quizmaster.
Yes, sir.
All right, moving on. So since the Super Scrubs has the highest points, they'll be starting this round. Can you all see my screen?
Yes, Quizmaster. Yes, Quizmaster.
Yes, Quizmaster.
Sorry, I can't hear you.
Yes, Quizmaster.
Yes, Quizmaster.
Can anyone speak? I don't think I am able to hear you guys.
Yes, Quizmaster.
Yes, Quizmaster.
All right. So, Super Scrubs, what do you want? What did you say?
Quizmaster, we want the banana, the last one. Is that a banana?
Yes, it is. All right, you got the last set. So, are you ready for your first case?
Yes, Quizmaster.
All right, and here you go. Okay, before I talk to you about the cases, I would like to tell you about the rules for this round. There are no negative points. For getting the diagnosis right, you'll get 100 points. And for getting the 2 follow-up questions right, you'll get 50 for each question. And there are, again, like I said, there are no negative points. If you get the diagnosis wrong, then the case is done for you. You'll move on to the next case. Each team will be getting 3 cases, 3 questions per case. Make sense?
Yes, Quizmaster.
Yes, Quizmaster.
All right. Now moving on to the first case. A 54-year-old male presented to her family physician with a palpable mass and pain in the epigastric region. General examination showed anemia, asthenia, and also complaint of anorexia, vomiting, and weight loss. He also revealed that she carried a history of Helicobacter pylori infection 5 years back. On examination, Irish node is examined. Blummer's sign is positive in digital rectal examination. An upper endoscopy was obtained that showed a large ulcerated tumor in the body of stomach. Biopsy was performed. Gross and histopathologic findings are given below. That is these slides that you see. And here's your first question. What is the most probable diagnosis?
Sir, is it gastric carcinoma?
Can you be more specific?
Adenocarcinoma, Quizmaster.
That's exactly right. You get 100 points. And now, moving on to the second question of this case. What does Helicobacter pylori cause?
Is it peptic ulcer, Quizmaster?
Yep, that's absolutely right. You get 50 points. So you got a total of 150 so far. Moving on to the last question of this case. What are Blummer's sign and Irish node?
Sir, Irish node is metastasis of the gastric carcinoma to anterior axillary node, left anterior axillary node. Blummer's sign is metastasis to pouch of Douglas.
That's exactly right. So in total, you get 200 points for this case. Are you ready for your next case?
Yes, Quizmaster.
All right. A 50-year-old woman visited the hospital with complaints of lower backache and pain radiating to the hamstrings. On physical examination, the doctor found that the spinous process of L5 was abnormally prominent. The image is given here. You can look at it. A diagnosis of X was made, reasoning breakage of pars interarticularis. The condition was surgically operated by decompression and instrumental fusion. The post-operative X-ray is seen here. Are you ready for your question?
Yes, Quizmaster.
What is the most probable diagnosis?
Quizmaster, can we see the X-ray again?
Sure. Which one do you want? The pre-operative or post-operative?
First one, first.
Superscripts, your answer, please.
Is it spondylolisthesis?
That is absolutely right, and you get 100 points. Can you please tell me where you read about this?
Shram, osteology.
All right. So it is spondylolisthesis. Are you ready for your second question?
Yes,
Quizmaster.
How can the diagnosis be confirmed? What would you do?
Quizmaster, we're just guessing. Is it X-ray?
It is a radiological study.
Is it computer?
No. Is it MRI? Quizmaster.
Can you be more specific?
Abdominal MRI.
We don't
Okay.
know Quizmaster. More than this.
Okay, there are no negative points here. So do you want to have MRI as your final answer?
Yes, Quizmaster.
Yes, Quizmaster.
Okay, I will accept MRI. Can you at least tell me what section you will take? or which region you would scan?
Quizmaster, is it lumbosacral region, sagittal section?
That is absolutely right. So you get 50 points. Sagittal MRI of lumbosacral region. Moving on to question number 3. In normal conditions, which part of L5 and sacrum lock with each other?
Is it Quizmaster? Is it body of
L5.
sacrum and body of L5 and base of sacrum?
Can you be more specific? Because body of L5 and base of sacrum is like really broad. I can't accept it. What processes?
So what did you say again?
Which processes lock?
Is it the inferior articular process of L5 and
We are not sure.
for the sacrum, we're just going to say base of sacrum.
Okay. That's your final answer?
Yes, Quizmaster.
Yeah, 1 second.
You're past your time, so I'll take your last answer as your final answer.
Yes, Quizmaster.
So the answer is the inferior articular process of L5 vertebra interlock with the articular process of sacrum. Since you almost got it right, I'll give you 40 points instead of 50. So can we move on to the next case, your last one? Super Scrubs, can we go to the last case?
Yes, Quizmaster.
What do you think this could be? Any
Quizmaster, the
guesses?
slide hasn't changed.
I know. I'm just asking you to guess what this case might be.
Like something related to
Kidney.
or some visceral organ.
We'll see what it is. A 21-day-old infant presented with lethargy, dehydration, and hyperpigmentation. Lab tests revealed hyponatremia and hyperkalemia. ABG showed NAGMA. ECG revealed broad complex bradycardia. 17-hydroxyprogesterone was found to be elevated. Are you ready for your first question?
Yes, Quizmaster.
What's the probable diagnosis?
Quizmaster, we won't have any negative points, right?
No, you won't have any negatives.
Is it androgen insensitivity syndrome?
Is that your final answer?
Yes, Quizmaster.
I'm very sorry, but that's not the right answer. It's congenital adrenal hyperplasia. So you don't get any points for this case. And you also don't get to just answer the last 2 questions. All right?
Quizmaster.
So tell me, what is ABG?
Arterial blood gas.
Yes, that's correct. I want this team Super Scrubs to answer it.
Must
And
be
what's NAGMA?
We've heard the term somewhere, but we don't
Uh-huh.
know. We just two more guests, Quizmaster.
Guess what?
Answer. We have no idea about that.
You really don't have any idea about it. Are you sure?
We've heard the term NAGMA, but except that we don't know anything in this.
It's normal anion gap metabolic acidosis. Heard of it?
We read it in physiology, somewhere related to in renal.
Yes, it's in physiology, it's in biochemistry.
It's in. We didn't remember. We couldn't recall it. Quizmaster.
All right. Do you want to try the other two questions just for the sake of it?
No.
We just see it, Quizmaster.
All right. The USG revealed, actually, the answer is congenital adrenal hyperplasia. So, the USG revealed enlarged adrenal glands. What causes the hyperplasia of adrenal glands in this condition?
We don't know. We don't know.
You don't know. Okay. Let me tell you a little story here. So, the adrenal glands, they secrete what?
They secrete catecholamines,
Mhm.
Sex hormones,
and
mineralocorticoids,
And what stimulates the adrenal gland to secrete these?
ACTH.
Right. So, if you don't have the secretions, will ACTH go down?
If you, no, I don't think so. Quizmaster.
So, the negative feedback inhibition is not happening. So, ACTH will continue to be increased and elevated in your plasma. ACTH is a growth factor which stimulates your adrenal glands. So, that causes hyperplasia. What is hyperplasia?
Overactivity.
Overactivity. Are you sure?
Over.
Yes, it's overgrowth. So, yeah, that is why hyperplasia occurs in this condition. Did you get it?
Yes, Quizmaster.
All right. What complication of desmolis deficiency will be there? So, see, congenital adrenal hyperplasia, there could be, it's a enzyme defect in your catecholamine synthesis pathway. All right. Not only catecholamines, but also your sterols. So, what if the enzyme desmolase is deficient? What will happen? Take a guess.
No, I mean, we don't know Quizmaster.
All right. So, desmolase is a key enzyme in that pathway. So, without desmolase, you won't be having any other steroid hormone synthesis. Because of that, the fetus will not be viable. Can you tell me why? Because placenta is the one that secretes progesterone and maintains the pregnancy. So the fetus is having a desmolase deficiency. Then why is the fetus not viable? Have you heard of the term fetoplacental unit? And anyone else want to try?
Yes, Quizmaster.
Yeah, go ahead.
From Team Triumphant Triad. Normally, during like in utero, the adrenal glands has a fetal zone which is responsible for producing epiandrosterone, which is actually the substrate for producing which is a substrate for the placenta to produce to produce hormones. Like without that adrenal without the adrenal like desmolase deficiency, that epiandrosterone will not be produced, which leads to inviable fetus.
Exactly. So you cannot have a person who has desmolase deficiency because that person won't even be born. All right. So that brings the end of first case. So can we move on to the next team? Once again, guys, there's a problem with the presentation. Triumphant Reyes, be ready. You will be going next.
Yes, Quizmaster.
All right. The triumphant triads. What do you want?
The loaf of baguette. Loaf of
Right. You'll be getting set 2.
Yes, Quizmaster.
Yep. And your first case is a 6.5-year-old boy born of a second-degree consanguineous marriage was admitted with severe epistaxis and abdominal distension for 2 days. There was no history of bleeding from any other site, trauma, or bowel disturbance. No past history of jaundice, hematemesis, abdominal distension, or a bleeding disorder. His scholastic performance was satisfactory. He was the youngest of 4 siblings. First 2 were healthy. The third sibling had died at 10 years of age following severe epistaxis and mild jaundice with cause not known. Examination revealed a stuporous child with low-grade fever, severe icterus, pedal edema, a hepatomegaly of 3 cm with short border and smooth surface, and splenomegaly of 3 cm with ascites, but no pallor. Slit examination was done. So the investigations are as follows. The hemoglobin was at 10.8 gram per deciliter. Total and differential leukocyte counts were within normal limits. Total serum bilirubin was 23 milligram per deciliter direct and was positive. SGOT was 112, SGPT was 22, alkaline phosphatase 28.4, prothrombin time was 2 minutes 9 seconds, and HbS-Ag was negative. And the slit lab examination revealed the following picture. Are you ready for your first question? The triumphant triads.
Could we see the previous slide, Quizmaster?
The triumphant triads, your discussion should be happening at Google Meet because only your team is going to be discussing this.
Okay, Quizmaster. Srinivas, unmute. Okay,
Yeah.
so the third sibling had died, mild jaundice with no cause. Epistaxis was there. Okay. Severe icterus shows jaundice and some liver abnormality. Splenomegaly is also seen. Splenomegaly could be due to any block in the splenal vessels leading to accumulation of blood. Ascites means something to do with liver. So
Liver,
this
yes.
is proper liver. This is mainly liver.
And
Examination
examination
was okay.
showed
In the Quizmaster, could you show us the next slide?
Sure.
it's got
Okay, so
levels are
SGPT is in normal, SGOT is increased, bilirubin is also
Time
increased.
is also
Alkaline phosphatase is within normal limits, so no obstruction. Only SGOT is raising alarms here because it should be within 40 international units. Okay, no antigens, so no we can rule out hepatitis.
hepatitis can be removed, yeah.
Total
Your
differential
sound is
leukocyte.
also-
Okay. Hemoglobin seems low to me. So
The
yes, Master,
triumphant
we would like to
triads,
see
your
the
time is running out, so I have to move to the first question. Are you ready?
yes, Quiz
Yes,
Master.
Master.
What's the most probable diagnosis?
Could we go with Budd-Chiari syndrome?
Is that your final answer?
sure.
Srinivas, Kavya.
If there's an obstruction,
See, Budd-Chiari syndrome means there is
yeah, there's an
blockage.
obstruction, yeah.
So the spleen
Yeah,
will also
yeah.
be affected.
Okay.
We would like to go with that, Quiz Master.
So Budd-Chiari syndrome is your final answer. Am I right?
Yes, Quiz. Yes, Quiz Master.
I'm very sorry, but that is not the right answer. We actually gave you a very big hint in this slide. Can you identify what it is?
Sir, the
Okay,
AST
copper
voted
affiliation.
The triumphant triads, please answer. Others, stay muted.
Okay, we can see some rings around the eye.
What are they called as?
It's a congenital disorder.
Yes.
Could be due to Wilson's disease.
Yes, it is Wilson's disease. What are those rings known as? What are the rings that you see called as?
Katsky.
Sorry? Any other team want to try?
Sir, is it
It is Kaiser-Fleischer rings. Heard of it? Triumphant triads.
Yes, Quizmaster. We got confused with Katsky rings seen in the esophagus.
So you don't get any points for this case. I'm sorry. Again, the characteristic sign seen in cornea is your Kaiser-Fleischer rings. Do you want to try the next question just for the heck of it?
Yes, Quizmaster.
What's the gene effect?
Wilson disease. It's something to do with copper. Something to do with like copper excretion in bile, along with like copper, upper ceruloplasmin and copper combination.
Yeah.
We don't know the exact gene.
Any other team? Okay, it's the ATP7B gene. ATP genes are antigen binding cascade genes. They are called ABC cassette proteins. Yep. So, moving on. Are you ready for your second case?
Yes,
Yes, Quizmaster.
A 35-year-old female presented to the clinic with symptoms of severe pain in upper right area of abdomen, fever, headache, and feeling of poor health. The physician confirmed that she has a complication of pelvic inflammatory disease and infection in the upper genital tract by taking radio diagnosis and certain laboratory exams. Are you ready for your first question?
yes.
Yes, Quizmaster.
What's the probable diagnosis?
UPI can lead to some like it could be like a.
Could you go to the previous slide, Quizmaster?
Upper genital tract infection and PID leads to like a.
Okay, upper right area means something to do with liver. Okay, so basically, there was a
PID is
complication
also
and
there.
an infection, STD. So it could have spread through the uterine tubes, and STD could have.
Is it understanding?
It's a Hugh-Fitz-Curtis syndrome.
Is that your final answer?
No, Quizmaster, we are just discussing. See, upper right area left means the area of liver. So the peritoneal fluid goes in like clockwise. So it could be that, like the subhepatic region is most effective. Should we go with that?
Yeah, but are they asking for which STD?
There's nothing else given. Pelvic
Triumphant triads, your
inflammatory.
time is running out. What's your final answer?
Fitz-Hugh-Curtis syndrome.
All right. And that is
Yes.
absolutely right. You get 100 points. Are you ready for your second question?
Yes,
Yes, Quizmaster.
How's it cost?
Okay, the STD will travel up through the like it will travel up retrograde direction, and it will since the uterine tubes are communicating with the peritoneal cavity through an ostium, they can go in, and peritoneal fluid moves in a clockwise direction, so it can go and cause a subhepatic infection that leads to all those conditions.
Great. So I'll give you 50 points for that question. So actually, our answer was very simple. It's just infections caused by STIs. So yeah, are you ready for your third question?
Yes.
Yes, Christmas.
I think it'll be simple for you. How will you treat it?
Please, now you'll be giving the
Antibiotic theory. I mean, antibiotics.
Yeah, that's the answer. So you get 200 points for this case. Are you ready for your final case?
Yes,
Christmas.
All right, here you go. A newborn baby presents with wrinkly belly with multiple folds of skin and urinary tract organs, and the outlines of intestines are easy to feel through the belly. The physician also identifies the absence of abdominal muscles. Undescended testis was noted. USG abdomen revealed hydronephrosis.
This could be prune belly syndrome, right? Because no muscles, no muscles.
Abdominal muscles and there's undescended.
Yeah, wrinkly belly, skin is only there. Okay, we are ready to go with the option prune belly syndrome, where the muscles are absent.
That is absolutely right, and you get 100 points for this. Can you tell me any other name for prune belly syndrome?
The anterior abdominal muscles are.
Sir, is it called Eagle-Barrett syndrome?
Yes, it is Eagle-Barrett syndrome. Which team was it?
Humorous guys.
All right. So, are you ready for your next question?
Yes,
Yes, Quizmaster.
What is hydronephrosis?
There's a block, so like urine, it passes, it comes back to the kidney, and then there's dilation. Like
can you condense it down?
Okay, a blockage in any of the urine conducting pathways will lead to the backflow of urine into the renal pelvis. That leads to hydronephrosis.
All right, great. You get 50 points for this. And your last question. What is vesicourethral reflex?
When there's an infection in the urinary bladder, it ascends to the kidney through the vesicourethral junction over there.
Yeah,
ascending.
Yes, that area there is a constriction, right? Where
in the region of vesicle.
Yeah, the urinary bladder wall also, like
there's
it's not really compressed.
So what's your final answer?
So Quizmaster, could we have another second to discuss?
Sure. Go ahead.
Okay, so basically, I believe that from the urinary bladder, the urine, refluxes goes back up into the ureter.
Through the ureter,
Quizmaster, final answer. Vesicourethral reflux refers to the backflow of urine from the urinary bladder back into the ureter through the vesicourethral junction, which is there on the supralateral angle of the bladder. This is caused due to any infection.
Yep, that is absolutely right, and you get 50 points for this question, and that brings your total to 400 for clinical case rounds. So the triumphant triads, you're done. Now we are moving on with the next team, which is Med Zeppelin. Med Zeppelin?
Yes, sir. We're going with the first one.
Where are your teammates? I don't see them on screen.
Here. Yes, sir.
Okay. All right. So, which icon do you want?
First one, sir.
First one. All right. Here you go. So, you're set one. So, are you ready for your first case?
Yes.
A 40-year-old woman presents with a long history of right upper abdominal pain and frequent indigestion. Physical examination reveals an obese woman with jaundice and abdominal tenderness. Serum bilirubin is elevated. There is a mild increase in serum AST and ALT. The values of all these are given on the slide. You can read them. And a moderate increase in alkaline phosphatase. Markers for viral hepatitis are negative. Abdominal ultrasound examination shows echogenic stone-like material within gallbladder and thickening of the gallbladder wall. A cholecystectomy was performed. Biopsy was done. Histologic examination shows dense fibrosis and glandular structures in the wall of the gallbladder. Are you ready for your first question?
Yes, Quizmaster.
What's the most probable diagnosis?
So could we see the previous slides?
Yes.
Guys, thickening of gallbladder wall. So it is a condition in acute cholecystitis. Thickening of gallbladder wall.
If it's like fibrosis or glandular structure, it's some sort of lesion.
No, but there's a glandular.
Do you mean like tumor?
No, it's not this fibrosis and glandular structure in the wall of.
So could we see the values? AST, ALT. Increase.
I think it's cholecystitis.
Wait.
As your time is running out, please make it fast.
You're saying it's cholecystitis?
Cholecystitis. Long history of right upper abdominal pain.
If it's I feel like it's a lesion.
Medzeppelin, your time is up. What's your answer?
Acute cholecystitis.
Yes, sir.
Is that your final answer?
Acute cholecystitis.
Team captain,
Yes, Quizmaster.
what's your final answer?
Acute cholecystitis.
I'm sorry, but that is not the right answer. It's gallbladder carcinoma.
Dude.
So you don't get any points for this case. Do you want to try the other questions?
Yes, sir.
Yes, Quizmaster.
All right. So mention the water channel proteins present in the epithelium of gallbladder. Any other team?
Aquaporin 2.
Aquaporin is right, but the number is not right.
So it's 1, I think.
1 and?
1 and 8.
It's 1 and 8. So moving on to the third question. Name the nerve responsible for Moa sign.
Oh, Boa sign is the scapular pain we saw yesterday.
Yeah.
Is it scapular nerve?
No. Any other team?
Suprascapular nerve.
Supraclavicular.
Supraclavicular.
It's the right phrenic nerve.
Oh.
Okay. Are you ready for your second case?
Yes, Quizmaster.
All right. The given picture is a trans-abdominal ultrasound scan taken then. I'm sorry. It's a 21-year-old female came in for a regular pregnancy checkup at the end of the first trimester. Pregnancy was uneventful. The given picture is a trans-abdominal ultrasound scan taken then. Are you ready for your first question?
Yes, Quizmaster.
I'd like to point out one more thing in this slide. There is a dotted line running here. Can you see it?
Yes, Quizmaster.
All right. So your first question is, what is measured in the given scan?
So could we see the picture again? Sir, dude, is it like the place where they put the stethoscope to feel the sound?
It's a plane. Where is it?
I think
Zeppelin,
it's
your
like
time is running out.
it's the echoic area, hyper echoic area.
Is that your final answer?
I think so.
I'm sorry, but that's not right. The fetal crown rump length is being measured in the first trimester. So you don't get any points for this case either. We want to try the next two questions.
Yes, Quizmaster.
What is Wharton's jelly?
So the jelly in the umbilical cord.
I'm sorry?
It's the jelly in the umbilical cord.
I'm not able to hear what you're saying at the end.
The umbilical cord.
Yep, that's right. It's the ground substance of the mucous connective tissue of umbilical cord. What are the fetal and maternal contributions to the development of placenta?
Hello?
Any other team want to try it?
The chorionic.
I think the from the blastocyst, like the chorions develop, and the decidua basalis of the maternal tissue, they interdigitate from placenta.
That is correct. But you don't get any points for this since you didn't answer the first question right. Are you ready for your next, third and final case?
Yes, Quizmaster.
A 19-year-old male patient presents with hematuria, left flank abdominal pain, varicocele, and left testicular pain. Abdominal CT is done and the report is given. Are you ready for your first question?
Yes, Quizmaster.
What's the most probable diagnosis?
Swollen testicle because varicocele. So could we see the previous slides?
Syndrome.
Is that a mesh?
Yes, it is.
Mesh now, is it like hernia?
Nutcracker syndrome.
What?
Nutcracker syndrome. Varicocele. Nutcracker syndrome. The previous slide, sir.
Yes, nutcracker syndrome has hematuria and left flank abdominal pain.
Okay, you mean like the compression of the... Okay.
Discipline, your time is running out.
So we're going with nutcracker syndrome.
Do you think that's right?
Yes, Quizmaster.
That's correct, and you get 100 points for this case. Moving on to the next question. What causes left renal vein hypertension in this case?
The superior mesenteric artery compresses it against the aorta.
The team captain, please answer.
The superior mesenteric artery compresses the left renal vein against the aorta.
That is absolutely right, and you get 50 points for this question. And your final question. Explain left testicular plane.
The gonadal vein goes to the left renal vein.
So left
Yes.
testicular vein, varicocele.
So the left gonadal vein is drained into the left renal vein. So because that is also because left renal vein is compressed, that causes left testicular pain because that is supplied by the testis.
Supplied by or drained by?
Left testis is drained by the left testicular vein.
All right, that is right, and you get 50 points for this. So in total, you get 200 points for clinical case round.
Thank you,
And
Thank you, Quizmaster.
and moving on to the next team, the humorous guys.
So we'll just choose the tick sign.
I'm sorry, I don't see your teammates on screen. Can
Yes,
we?
sir.
Manasi, I don't see.
Yeah, yes. This was
All right. So what do you want?
The tick sign.
I'm sorry, which one?
The verified symbol.
Yeah, the very set simply.
All right.
Next one. God.
So you get set number 5. Are you ready for your first case? Are you ready for your first case?
Yes, sir.
A 32-year-old male admitted with severe upper abdominal pain and breathing difficulty of 1 day duration following a large meal. There was no history of alcohol intake preceding the event. He had 3 episodes of vomiting food particles. Similar episode was present 6 months back, which was relieved with medication. On examination, he was tachypneic and tachycardic. Tracheal and mediastinal shift to the right were present. Decreased air entry was noted in the left lower zones of lungs on auscultation. Chest X-ray was done. CECD was done to confirm the diagnosis. The reports are given here. Are you ready for your first question?
Previous slide once more. Thank you, sir.
Are you ready for your first question?
Yes, sir.
What's the most probable diagnosis?
Guys, so I'm thinking something to do with the esophagus.
Or any reflux disease.
Why can't it be related to the stomach?
The symptoms look like achalasia cardia or something. Cause see, he vomited after having a very fulfilling meal, and
Okay.
he also had breathing difficulties.
Okay.
So the esophagus must have
The
expanded.
lower esophagus. Okay.
Some obstruction in the foregut. It's either
Esophagus or stomach. It's not, yeah, it's probably esophagus. So could you show this X-ray and CT once more?
See, decreased air entry was noted in the left lower zones of the lung.
Okay, so it's not able
And
to.
trachea and mediastinum are shifted to the right. So it must be due to esophageal distension.
Okay.
Your time is running out. Please make it fast.
So we'll go with achalasia.
Yeah, fine.
Okay, so Quizmaster, we are going with achalasia cardia.
That's your final answer?
Yes.
I'm sorry, but that is not the right answer. So you get 0 points for this case. The answer is adult diaphragmatic hernia, Boglag type. This was an actual case that was recorded. So, and it's usually found in infants, but it's a rare presentation in adults. Do you want to try the other 2 questions?
Yes, sir.
Yeah.
What's the probable complication pertaining thorax?
Hypoplasia of the lung.
Pneumomediastinum.
There's a hernia through the diaphragm. So probably the contents of.
So usually,
Pleural effusion. Is it pleural effusion?
I'm guessing pulmonary hyperplasia, but it occurs in child. He's a 32-year-old male. I don't know.
It is pulmonary hyperplasia. And what is foramen of Boglack?
So the gap formed by the slips of diaphragm originating from the lumbar vertebra and costal and last ribs.
Last what?
Lateral arcuate ligament.
It's the posterolateral opening in the fetal diaphragm in the pleuroperitoneal hiatus or the costochondral triangle. Are you ready for your next case?
Yes.
Yeah.
21-year-old male noted pain in his right testicle. On self-examination, he noted a grape-sized mass in the right testicle. He had a history of orchopexy at the age of 12 months. Ultrasound revealed a solid mass on the right testicle with calcifications. Lab investigations revealed HCG of 550 units per ml, and the normal value is less than 5. CT of abdomen revealed enlarged retroperitoneal lymph nodes. That's the case, and are you ready for the first question?
Yes.
Yes, sir.
What's the most probable diagnosis?
So I'm guessing this is a kind of non-seminoma tumor containing the syncytiotrophoblast.
I guess it's some sort of
HCG is elevated.
HCG elevation occurs like in neoplasms, malignant neoplasms. It's malignant, obviously. Seminoma, seminoma is possible with syncytiotrophoblast like
No, HCG is not elevated in seminoma. It is elevated in non-seminoma tumor. I guess. So non-seminoma has different types.
What's your final answer?
It is increased in seminoma. The classic seminoma shows HCG increase.
Okay, then go for it.
Along with germ cell tumors also can show. Even choriocarcinoma.
Yeah. I guess it's choriocarcinoma.
You have to choose one out of these three. We'll go with classic seminoma, I guess. Because I guess that's...
I'm thinking more of choriocarcinoma.
Sorry, choriocarcinoma.
Okay. Quizmaster will go with choriocarcinoma of testis.
Choriocarcinoma of testis. Okay. I'll accept it because our answer was testicular cancer and you have more specific. So I'll give you 100 points for this. I think you have already answered the upcoming questions as well. So we'll see. What is the testis determining gene?
SRY.
30 points.
Yeah.
What are the major types of testicular cancers which you already answered? So just for the sake of it, just tell me again so that I can give you the points.
Choriocarcinoma.
So we have a seminocarcinoma and non-seminoma types. Within the non-seminoma types, you have yolk sac tumor, choriocarcinoma.
That's fine. We only expected seminoma, not seminoma. So you get 200 points for this. And I think I might give you bonus points for this. Let me discuss with my team for this. And moving on to case 3. A 10-month-old male child is brought to the ER by his mother as the child is crying and inconsolably, and the mother complains that he hasn't passed stools for 24 hours. In addition to this, there has been 1 episode of bleeding per rectal, according to the mother, and 2 episodes of vomiting. On examination, there is abdominal distension present. Barium enema revealed the following, and the slide is given there. That's the case, and are you ready for the first question?
Yes.
What's the most probable diagnosis?
It's probably like total hypertension, and there must be a
No. It's some kind of obstruction because the meconium has not passed yet.
It's 10 months old baby, right?
Oh, 10 months. Sorry.
Is it ascites?
It's either some. Sir, could you go to the previous slide once more?
Abdominal
See, there's abdominal distension.
See, the sigmoid colon is somewhat.
It can be anorectal fissure also. So could you go to the one more previous slide? There's bleeding per rector also. So obviously, it's something to do with rectum and canal. It sounds like anorectal fissure.
Or is it the sigmoid volvulus or something?
Sigmoid volvulus. Sigmoid volvulus would show a coffee.
Because I think the sigmoid volvulus presents with some kind of sigmoid shape.
Hey, no, da.
No?
Humorous guys, your time's running out.
It's either anorectal fissure or sigmoid volvulus.
You go with volvulus. Anorectal fissure, I don't think that will be done.
Very faint.
How do you want to go?
What's your final answer?
Let's go with one of them.
So, Quizmaster, our final answer is sigmoid volvulus.
I'm sorry, but that is not the right answer. The right answer is intussusception of colon. Do you want to try the other two questions?
Yeah, yes, sure.
What is intussusception?
Basically, one part of the beginning part of one part of the colon moves into the end part of the other part of the colon.
That is right. The segment of the intestine constricted by a wave of peristalsis telescopes into the immediately distal segment. Once wrapped, the invaginated segment is propelled by peristalsis and pulls the mesentery along with it. So that's intussusception. And the ileocolic region is the most commonly affected part in this case. Why?
So is it because
maybe is it because the longitudinal muscles are constricted to form tinea coli?
So is it because the ileal diameter is too small compared to the very large diameter of the large intestine, so it can easily intercept through it?
That is logical, but the actual answer is because of Peyer's patches. They act as a lead for intussusception. So the abundance of lymphoid tissue, in the terminal ileum, they cause this ileum to get intussuscepted into the colon. That's the cause of it. All right, I guess you have done your 3 cases.
Sir, about the bonus points?
We'll let you know after the break. So don't worry about it.
Thank you.
Yeah. So hold on, there is another problem with the presentation here. I'm very sorry about this. All right, the Smarticus, get ready. So, ready for your first case. All right. So, moving to the first case, you have a 56-year-old man presented with pain in the abdomen and back, clammy and sweaty skin to the clinic. He also tells that he can notice a pulsating feeling near his navel. The physician made ultrasound tests to confirm the diagnosis and also finds that he was a chronic smoker. Are you ready for your first question?
Yes, sir.
Smarticus, I don't see your teammates on screen.
Yes, I'm here.
Darshana, he's a chronic smoker and near the navel he can feel that pulsating heat.
Carcinoma.
Ah,
That naval sign must be that Mary too.
clammy and sweaty skin to the clinic. Pain in abdomen and back. He's a chronic smoker also. என்ன ஆகும்?
Maybe he's having some sort of carcinoma.
Smarticus, your time is running out.
Yes.
What's the most probable diagnosis?
Sir, is it gastric carcinoma?
Is that your final answer?
Yes, sir.
I'm very sorry, but it is not gastric carcinoma. It's abdominal aortic aneurysm.
Okay.
So, do you want to try the other two questions?
Yes, sir.
What layers of the aorta are affected?
The middle layer, tunica media, and tunica intima.
That's correct. What are the lateral branches of abdominal aorta?
Renal vein, renal artery. Lateral branches of abdominal aorta, left and right renal arteries, the lumbar arteries.
The gonadal
arteries.
Inferior
One more.
arteries. Inferior phrenic.
Fine. So it's the renal, suprarenal, gonadal, etc. All right. Are you ready for your next case?
Yes, sir.
A 33-year-old male presents with a 1-month history of episodes of mid-epigastric pain, a burning sensation in his chest, an associated dry cough, and occasional regurgitation. The pain worsens after eating and when he is lying flat. The patient has increasing postprandial fullness and early satiety. He also states waking up from the pain and burning with a sore throat and hoarse voice. The symptoms are partially relieved by adjusting from lying to a sitting position and with the use of over-the-counter medications, pantoprazole. The patient has been a marketing manager for a mid-sized company for 8 years. He does not smoke, use any medication or drugs other than the occasional OTC, and is a social drinker only. On examination, the results are on the slide, and endoscopy was also performed, and you can see the result of it.
Darshana, ulcer?
Yeah, it could be ulcer.
Gastric ulcer. Lavanya? Sir, first slide. Yeah, burning sensation in chest, dry cough, and he's feeling like pain worsens after eating. That means it is related only to stomach, not to duodenum. So the patient has increased postprandial fullness and early satiety. So related to stomach only, not small intestine. And he also said he's waking up from the pain and burning, and it is sore throat and hoarse. So we'll go with ulcer. Yeah.
So can we just go to the next one?
Sir, next slide.
Your time is running out. Please go fast.
Lavanya? Darshana?
Yeah. Okay.
Sir, is it the case of gastric ulcer?
Is that your final answer?
Yes, sir.
I'm very sorry, but this is not gastric ulcer. It's actually GERD, but the slide is wrong. So that's the answer for this. So how is pantoprazole helps in GERD?
No idea. அந்த regurgitation கொடுத்துருந்தது ஐயோ no idea.
Proton pump inhibitor.
Any other team want to try?
The proton pump inhibitor.
PPI.
Exactly. It's a proton pump inhibitor, so it reduces acid secretions. And your final question, chronic GERD leads to the replacement of squamous esophageal epithelium into intestinal type metaplasia. Name this condition.
Squamous cell carcinoma.
Squamous cell carcinoma. Do you remember this question? I think this was one of the Instagram quiz questions. It's Barrett's esophagus.
Okay.
Are you ready for your final case?
Yes, sir.
Yes, sir.
Yes, quiz master.
A 21-year-old male presented with bilateral progressive diminution of vision. The patient was diagnosed case of chronic hemorrhagic nephritis and was on dialysis. His elder brother died of chronic renal disease and at the age of 23. The patient also complained of progressive hearing loss and swelling all over the body. Lab tests revealed the following. Hemoglobin was 4.3 gram per deciliter, serum urea 232 milligram per deciliter, serum creatinine 13.1, sodium to 131, potassium 6.6, proteinuria positive, hematuria positive. Renal ultrasound showed normal sized kidneys with increased echogenicity. Audiometry revealed bilateral sensorineural hearing loss.
Alport syndrome, Rashna?
I have no idea.
Because he has got the hearing loss and it is a kidneys hematuria irukku, and we'll go with that.
Yeah, we'll go.
Sir, is this Alport syndrome?
Is that your final answer?
Yes, sir.
Yes, it is Alport syndrome, and you get 100 points for this case. Moving on to the next question. This little layer of Bowman's capsules contains specialized cells with extensions known as what?
Podocytes.
Podocytes.
Filtration slits.
What's your final answer?
With extensions means it is podocytes because between them only you will have
Podocytes.
Is that your final answer?
Lavanya, we'll go with that? Yes, sir.
Alright, so podocytes is right, and you get 50 points for that.
Okay.
And your final question. What type of collagen is
type
affected?
4. Type 4.
Alright, it is type 4. And you get 200 points for this case. With that, your team's chance is over. And again, I'm stopping the presentation now. The craving trimesters, be ready for the next cases.
Yes, Miss Master.
All right, the craving trimesters, go ahead. All right. Are you ready for your first case? A 33, which is shown in the given slide. Are you ready for your first question?
Yes.
What's the most probable diagnosis?
Something related to kidney.
Stones or
So can you please see the
died
previous
with
slide? Some urinary colic, something like that. Green leafy vegetables, dairy products, calcium deposits.
something related to stones or yes. So what are they depicted in the X-ray? I think so. Calcium oxalate stones or something.
Your time is running out.
Can both urinary colic.
Yeah.
Kaushika?
Yeah.
Sir, urinary colic, some stones in it.
Can you repeat it?
Urinary colic, sir.
Can you reframe your answer?
Some stones in the ureter.
All right, I'll accept it. It's urolithiasis and you get 100 points for it.
Thank you, sir.
And moving on to your next question. What are the treatment options that are available for treating urolithiasis?
Using laser therapy, you can fragment those stones.
Increasing the urine
Or
output.
another method is there.
Increasing urine output by giving some sodium
Drinking a lot of water. And the treatment is that
so they
using
use
laser
some
therapy, fragment those
replacements also.
Huh?
Replacements also there.
Replacement. So what is the final answer?
Some drugs or to make these stones soluble, we give some sodium bicarbonate.
You're asking the procedure, right?
Procedure.
What's your final answer?
No, they like one for breaking the stones. They'll insert something and all.
Janapriya, your time's up. What's your final answer?
Using laser therapy, we can fragment those stones. The PCN.
We can break the stones, sir, by inserting something into the.
Okay, how do you break the stones?
Using laser therapy, sir.
Okay. How does the laser get into the ureter?
Using a catheter.
Yeah.
Insert a tube and it fragments those stones. Either we can take those stones outside and fragment them, or we can use laser and we can fragment it inside itself if the stones are too large.
Do you know any other treatment options?
Drinking a lot of water can.
No, procedure. I'm asking about procedures.
Removing the ureter itself.
Removing the ureter?
No.
All right, since one of your answers is right, but we actually expected 3, but one of them was right. So I'll give you half points. So you get 25 for this question.
Okay, Christmas.
Okay.
So extracorporeal stoppage, lithotripsy, cytoscopy, and surgery. What you said, the laser thing, it's actually a part of cystoscopy, sorry. So extracorporeal shockwave lithotripsy is the go-to treatment for urolithiasis. Do you know what it is?
Which one, sir?
The extracorporeal shockwave lithotripsy.
No, sir.
No, sir.
It's when you use sound waves to break the stones from outside. So you give intensive sound waves to your posterior abdominal wall, and it breaks the ureteric stones. Your next question: pain fibers from ureter are carried by?
Sympathetic fibers. Sympathetic now?
Yes.
Yes. So sympathetic fibers.
Pain fiber. No. Do we have any plexus over there? Renal plexus is a bone.
Pain is carried by sympathetic one.
Yeah, I think we have some plexus over there.
What's your final answer?
Sympathetic fibers, sir.
Can you give me the levels?
S2, S3, S4.
Are you sure?
L2, L1, L2.
And
T11.
all right, I'll give you the points. T11 to L2. So the pain is referred to your groin and medial aspect of thigh. All right. For your next case, are you ready?
Yes, sir.
Yes, good master.
A 35-year-old male suffering from bipolar disorder presents with a history of abdominal distension and intermittent pain on left side of the abdomen for the past 1 week. The pain became very severe for the past 2 days, and he also complained about the non-passage of flatus and feces for the past 1 week. No episodes of vomiting. On palpation, the abdomen is tender on all 4 quadrants. Vitals are stable. CT reveals a pathognomic whirl pattern and dilated colon. What's the probable diagnosis?
Maybe Hirschsprung disease.
Hirschsprung.
Dilated colon. Sir, can we please go to the previous slide?
Previous slide, sir. No episodes of vomiting.
And can you please next slide? So the previous slide.
It is a bipolar actually, bipolar syndrome.
Left side of abdomen. Non-passage of flatus and feces. Something related to colon.
Yeah.
And dilation of colon. Or sigmoid volvulus. Or symptoms.
Actually, in Hirschsprung disease, we have vomiting there.
Vomiting on.
We'll have vomiting in Hirschsprung disease, but here there is no case of vomiting itself.
What's your final answer?
Or sigmoid volvulus. Sure.
Yeah.
Sir, sigmoid volvulus.
All right, sigmoid volvulus is the final answer. So, and that is actually correct, and you get 100 points for this. So, moving on to the next question. As a part of the initial investigation, X-ray is done. What is the sign that is seen in it?
We can see feather waves now. Some feathery appearance.
Enlargement of colon.
I have given you the X-ray. Can you just tell me what you're seeing there?
What appearance?
Inverted tube.
Any idea?
It's like bean shape
Inverted
only.
tube or bean shape.
Bean shape only.
Bean shape.
What's the final answer? Janapriya.
Yes.
What's your final answer?
Any idea, Kaushika, Kritika?
No negative points. You can just tell me whatever you're seeing.
Bean shape.
The feathery wave appearance is seen in some kind of condition. I don't know which one is it. But here it's not that.
So what is your answer now? Your timer is up. What is your answer?
Shaped.
Sorry?
Bean shaped colon.
All right, I'll accept it. Okay. And you get 50 points for it. It's coffee bean, kidney bean, bed tube. You can say anything for it. So moving on to your next question. What is volvulus?
The twisting of colon so that blood supply doesn't reach it.
Is it just the colon?
No, any organ.
And the mesentery also. Colon and the mesentery.
So can you compile it all into one single answer?
Any part of the body it gets twisted so that it doesn't receive blood supply.
Okay. And anything to add to it? Kaushika, you said something.
Obstruction. Bowel obstruction.
Okay, where does the twisting occur?
Hold on.
Here, sigmoid volvulus. So.
No, I'm asking just about volvulus. Any volvulus, where does the twisting occur?
Hold on only, sir.
No, any. It's not specific.
Okay, since you only answered partially, I'll give you 25 points for this. It's the twisting actually occurs at the point of attachment to the mesentery. All right, are you ready for your final case?
Yes, Christmas.
77-year-old male presented with a 5-day history of cough and shortness of breath. Nasal swab was taken and RT-PCR test was run. The patient turned out to be positive for COVID-19. On the 7th day of admission, the patient's condition improved. However, on the 11th day, the patient complained of intermittent abdominal pain and intolerance to diet. Due to high serum creatinine, non-contrast CT was done. And the CT is given here. Within a short time, the patient developed severe progressive abdominal pain with leukocytosis and metabolic acidosis. Generalized tenderness of abdomen was found. Small intestinal wall thickening and increased thickness of mesenteric fat is observed. Patient was taken for laparotomy and the following structures were resected. It's given there. Are you ready for your first question?
Yes, Christmas.
Yes, Christmas.
What's the most probable diagnosis?
Previous slides.
You can see thickening and increased thickness of mesenteric fat over there. Something related to COVID-19.
Okay, we have metabolic acidosis also. So what is thickening of the mesenteric fat?
He got this condition on the 11th day of COVID. So only some side effect of antibiotic which was given to treat COVID.
Okay.
Sir, can we please see the previous slide? Serum creatinine is high.
Some renal problem.
Maybe.
Because metabolic acidosis also occurs due to.
So what should we answer?
Your time is running out.
What should we do?
Some type of renal failure, maybe. Don't know.
Thickening of mesenteric fat is seen.
Yeah.
Why is it again?
What would be the cause for thickening of the mesenteric fat?
What is your final answer?
Something related to kidneys. Due to high serum creatinine, metabolic acidosis is seen.
Okay.
Mesenteric fat.
So your final answer is?
We don't have any idea, sir.
So you're not going to answer anything for this? Not even a try? There's no negative points?
Let's say any kidney disease.
Anything related to kidney.
Sorry, that is not right, and you don't get any points for this. The answer is acute mesenteric ischemia. This is an actual case recorded in Iran on March 17, 2020. So, can you tell me why COVID-19 causes acute mesenteric ischemia? Why did that guy with COVID-19 ended up with acute eccentric ischemia.
Something related to blood.
No enough oxygen.
And COVID-19 clotting of blood takes
Blood flow related to blood flow.
ischemia.
Exactly. So the spike protein present in SARS-CoV-2, it mimics the antigen present in platelets. So the antibodies secreted against the virus also attacks your platelets, which causes coagulation. So that is why you see hypercoagulable states in COVID patients. Do you know that heparin is being given to patients who are admitted for COVID? Heparin is being given subcutaneously for them. What is heparin?
It is a virus.
That affects.
Sorry, what is it?
Hepatitis B is a virus.
I'm talking about heparin.
Oh,
Not
heparin.
hepatitis. What is heparin?
It's an
Anticoagulant.
Anticoagulant.
Yeah. In order to prevent clots, heparin is being given there. So moving on to the next question, just giving it a try. What are the right side branches of superior mesenteric artery?
Jejunal.
Neocolic, middle colic, and right colic.
One more.
Inferior pancreatic organ.
Exactly. But you don't get any points for this. Where is the pain from small bowel referred to?
Umbilical region.
Umbilical or epigastric.
Periumbilical region.
Very.
All right. So moving on. Portohepatitis. Are you ready?
Yes, Quiz Master.
What do you want?
We want the dumplings.
Dumplings. All right. Here you go. Are you ready for your first case?
Yes, sir. Yes, Quiz Master.
54-year-old woman complains of persistent abdominal pain, anorexia, and abdominal distension. Her past medical history shows that she was previously admitted in the hospital for acute pancreatitis. Physical examination shows that she has jaundice and non-pulsatile abdominal mass. Laboratory studies revealed the following. A CT scan of the abdomen showed a fluid-filled cavity in the head of pancreas, which is shown here. Are you ready for your first question?
Yes, Quiz Master.
What's the most probable diagnosis?
Since she had acute pancreatitis, maybe because of that, it just relapsed, and basically her pancreas isn't working, and because of that, proteins aren't being, trypsin and all these enzymes aren't being synthesized. Proteins.
So, previous slide, sir. Oh, wait, one sec.
And since proteins are not being digested, it leads to ascites.
Yeah, I think so. It's pancreatic ascites. So, the previous slide, sir. Tension. But she has jaundice, right? Ascites is not due to like that.
No, ascites. So yeah, basically there's a liver involvement also because of that. Because ascites can be caused by
some infection, right?
Of liver also.
Your time is running out. What's your final answer? Portohepatitis. What's your final answer?
You go with whatever you say, Amit.
I don't know.
So you're not going to answer this?
No, question.
So go for ascites itself, so pancreatic ascites.
Pancreatic ascites. Is that your final answer?
No.
No, your time's up. I'm going to consider that your final answer, and that is actually wrong. So you don't get any points for this. It's pseudocyst of pancreas. It was clearly mentioned that fluid-filled cavity in the head of pancreas.
Oh, sis.
So you don't get any points for this. Can you define this condition? Photohepatitis?
There is autodigestion also. I remember it affects the lesser omentum.
Okay.
I'm not sure.
Okay, so this is a collection of amylase-rich fluid enclosed in a well-defined wall of fibrous or granulation tissue. Tell me about the development of head of pancreas. Where does it develop from?
Sir, it is from the ventral bud, sir.
Okay.
Of the pancreas. Then where it develops?
Only the ventral part?
No, there are
No.
two buds.
Ventral bud and dorsal bud. So ventral bud is as a major.
The head
major
all that parts. The dorsal bud develops.
Contribution is major from ventral bud, sir, and dorsal and a little part of the dorsal bud. That's anterior part of the dorsal bud.
So yes, both ventral and dorsal bud contribute to the development of the head of pancreas. And I also wanted to add one more thing in the COVID-19 case. So the team which answered before. So do you want to? Can you tell me why there was acidosis seen in acute mesenteric ischemia?
No ideas.
So whenever you have ischemia or necrosis, you get acidosis there because lactic acid is being released. Anaerobic respiration causes lactic acid production, so you get acidosis right there.
Okay.
So photohepatitis. Moving on to the next case for you. A 53-year-old male presented to the OPD with symptoms of abdominal distension, sense of fullness, indigestion, and nausea. His peritoneal fluid is assayed, and a physician detects presence of chylomicrons and triglyceride level higher than 200 mg per deciliter. Are you ready for your first question? Photohepatitis. Are you ready for your first?
So,
what's the most probable diagnosis?
The previous slide, sir. Peritoneal fluid. The chylomicrons, your fat level is higher, right? So,
since this is a short case, you have less time to discuss this. Please make it fast.
Okay, sir.
Lipases, maybe they're not secreted properly. Chylomicrons.
I think so, like small intestine, something.
Photohepatitis. What's your final answer?
Indigestion.
Lipasemia.
Is that your final answer?
Yes, Ghostmaster.
Lipasemia is your final answer. I'm sorry, but that is not right. It's chylomicrons. So you don't get any points for this. At what vertebral level is cisterna chyli located at?
L1, L2.
Yes, that is correct, but you don't get any points since you didn't answer it right. Structures pierced during midline paracentesis, superficial to deep.
Skin, superficial fascia.
Superficial fascia. Is it present in abdominal wall?
Sorry, the aponeurosis. Midline, you have the three muscles unite to form an aponeurosis there. What is it called? That and then the anterior three muscles.
Yeah, I know that.
Semilunaris something.
The transverse abdominis, the two oblique muscles they'll join. What is it? Anterior abdominal aponeurosis. What is it? That
Okay.
one.
The answer is skin, campus fascia, scarpa fascia, linea alba, transversalis fascia, extraperitoneal fat, parietal peritoneum. Yep. So, moving on to your next case. A 70-year-old male with a history of treated syphilis was admitted to the emergency department with fever and signs of bacteremia. He reported pain in the limbs, failure of muscle coordination, and increased voiding intervals. Analysis of CSF shows an increased protein level and lymphocytic pleocytosis. Urodynamic study revealed retrocessor areflexia. Are you ready for your first question?
So wait, sir. This condition of nutriting the limbs and to muscle coordination increased voiding. The first question, probable diagnosis.
What's the most probable diagnosis? You have already consumed a bit of your time.
Yes.
No idea, Quizmaster.
No.
Take a guess. You recently wrote an IA in this chapter, maybe last month.
Can we see it again?
The previous
Your time's up. So your answer is neurogenic bladder.
Oh.
As a complication of tabes dorsalis.
Yes.
It's actually a case of tabes dorsalis, and the urological symptom is neurogenic bladder. What are the effect of sympathetic and parasympathetic nerves on bladder?
Sympathetic helps in filling of bladder and
parasympathetic is
parasympathetic allows the relaxation of the external urethral sphincter. Sorry, internal.
No, the detrusor muscles, and parasympathetic is a relaxation of the detrusor muscles and constriction of the internal. Internal sphincter, and sympathetic is
relaxation of detrusor muscle and constriction of sphincter.
Relaxation of.
So sympathetic supply causes relaxation of detrusor and urine retention. Parasympathetic supply causes contraction of detrusor and stimulates micturition. Sympathetic is derived from T12 to L2, and parasympathetic is derived from S2 to S4 through the pelvic nerve. That is derived from which embryological structure?
Sir, it is a urogenital sinus from the upper part of the upper part urogenital.
And also trigone. Mesonephric duct.
Yeah, trigone is from the mesonephric duct.
That is correct. All right, moving on. The last team, trios abdominos. Are you ready?
Yes, sir.
Yes, sir.
Sir, actually, Joshi is having some having some work problems.
Okay, should we wait or can we move on without your teammate? But she is not allowed to join back in the middle.
Okay, sir.
Are you sure?
Yes, sir.
All right. So I think only one is left. Please choose that.
The wrong sign with
The wrong sign. Are you ready for your first case?
Yes.
A 22-year-old female presented to the ER with worsening lower right pelvic pain, nausea, vomiting, and vaginal bleeding. She reported rapid weight gain, irregular menses, and denied hirsutism, acne, or hair loss. Abdominal striae were found. Transvaginal ultrasound and CT revealed the septated right adnexal mass containing flat, fluid, and calcification. Laparoscopic entry was done, and right ovary fossa was found to be tossed with large dermoid cyst. What's the most probable diagnosis?
We'll move to the first slide, sir. Previous slides. There's the presence of pelvic pain. Previous slides, sir. Nausea, vomiting, bleeding. Next slide. Multiseptated right adrenal mass, adnexal mass. Is it cyst of ovary or something? Sorry.
Your time's up. What's your final answer?
Ovarian cyst, sir.
Ovarian cyst. Can you be more specific?
Don't know, sir. Ovarian cyst.
Sorry, but that is not the right answer. It's ovarian teratoma. From what cells do teratomas originate?
No idea.
Any other team?
Pluripotent stem cells.
Pluripotent stem cells.
Yeah, it's a tumor of germ cell origin. Primordial germ cells arises from what? Any other team?
Epiblast.
Epiblast.
So, are you ready for your next case?
Yes.
A 30-year-old North Indian female presented with palpitation and secondary amenorrhea. She was seen and evaluated for possible hyperthyroidism. On examination, she was pale and ill-looking with a few after ulcers in her oral cavity. Gynecological examination revealed no abnormalities. Her investigation showed hemoglobin of 8 mg per deciliter with iron and folate deficiency and evidence of osteoporosis. The patient also presented with subepidermal blisters on her extensor surfaces, elbows, and knees. Anti-Gadian and anti-endomysial antibodies were positive. Endoscopic duodenal biopsy revealed total villus atrophy. What's the most probable diagnosis?
Previous slide, sir. There's a villus atrophy. We study about the syndrome of villus atrophy.
What's your final answer?
So previous slide, sir. No, sir, we don't have. Don't know, sir.
All right. The answer is celiac disease. Okay. So, what type of diet is recommended for this patient? Hey, come on, you hear this everywhere. Any other team wants to try it?
Gluten-free diet, barley, rye, oat and wheat.
So, gluten-free diet. Name the skin disease associated with the above diagnosis. Any other team?
Sir, is it dermatitis herpetiformis or something?
Yes, it is dermatitis herpetiformis. All right, moving on to the final case. Middle-aged, overweight man presents to the clinic with a condition where linea alba stretches laterally as the two rectus muscles separate in the upper abdomen. A picture corresponding is shown. Are you ready for your first question? What is the most probable diagnosis?
So previous height. Linea alba is not.
What's your answer?
You don't know, sir.
Okay. So the answer is divarication of recti or rectus diastasis. Name the origin of rectus abdominis.
So from pubic tubercle.
Origin. All right. The lateral head is from the pubic crest and medial head is from the pubic symphysis. Posterior rectus sheath is formed by what?
Sir, it is formed by external aponeurosis.
External aponeurosis. Posterior rectus sheath.
Transverse abdominis is an internal oblique muscle.
Yes. Internal oblique, can you be more specific?
The posterior layer of internal.
Okay. So the fusion of aponeurosis of transverse abdominis with the posterior lamina of internal oblique. Yes, we are done with the clinical presentation rounds. So we are after the break, and rapid fire will continue after this. And yes, humorous guys, we'll look into your points. Don't worry about it.
Thank you, Quizmaster.
Inside me, son of a god. I'm like a titan that's rising, oh just you watch. I'm stepping into fate, there is no time to waste. I've got that's rising, oh, just you watch. I'm stepping into fate. There is no time to waste. I've got that lightning inside me. This is how legends are made. This is how legends are made. This is how legends are made. I've got that lightning inside me, son of a god. I'm like a titan that's rising, oh, just you watch. I'm stepping into fate. There is no time to waste. I've got that lightning inside me. This is how legends are made. This is how legends are made. This is how legends are made. I've got that lightning inside me.
Entire screen. Okay. So the humor is, guys, you're getting a bonus of 50 points. So here's the scoreboard after updating the results from clinical case scenario round. On top of the table, we have Super Scrubs leading with 4,440 points. In the second position, we have Triumphant Rides with 4,140 points. Next, we have Med Zeppelin with 2,680 points. Followed by Humorous Guys with 2,280 points. Craving Cremasters with 1,400 points. Smarticus with 1,335 points. Porta Hepatis with 970 and Trios Abdominis with 780 points. So are you guys ready for the rapid fire round? So final round of semi-finals. So we'll start with Super Scrubs. They're at the top of the table. Super Scrubs. Okay, so before starting, I'll make it clear about how this goes on. So each team will get to select a set. Initially, the first question will be displayed. If the team gets then there'll be 30 seconds will be allotted for the first question. If the team gets it right, 20 seconds will be allotted for the first question. If the team gets it right, 25 points will be given, and we progress to the next set of 5 questions. And if the team doesn't answer within the timer goes off, or if they answer it incorrectly, the 25 points will be deducted, and we'll be moving to the next team. In the next set of 5 questions, there'll be 20 seconds given. 30 seconds given. And the team has to answer all the 5 questions before the time ends. And as soon as the timer ends, the team captain has to report the answer for all the 5 questions. For every correct answer, 15 points will be given, and if it's incorrect, 15 points will be deducted. Okay. So Super Scrubs. Choose which one do you want, which set do you want?
Quizmaster, we want the dung beetle.
The 8th one.
Yeah.
Okay. So ready for the first question? This is the main question. Only if you answer this correctly, we'll be moving to the set of 5. Okay?
Yes.
Okay, so here you go. Answer. The team captain, Sri Raksha. Okay, so the answers, since you guys haven't answered within the timer went off, so you lose your chance at this round. So we move to the next team, Triumphant Triads.
Quizmaster, a doubt. Does
Yeah.
this question have negative?
Yeah, if you answer it incorrect, 25 points will be deducted.
Thank you.
So moving on. Okay, the answer for this is Ilya Katri.
We'll take the first one. The bear.
Triumphant Triad. The bear.
We're taking the bear.
Ready for your question?
Yes, Quizmaster.
Yes, Quizmaster.
Here you go.
Triangle of Gallet. Triangle of Gallet.
The final answer?
Triangle of Gallet.
Okay, that's the wrong answer. It's hepatobiliary triangle. So you know the difference between the two?
I think the Gallet triangle is formed by an cystic artery as the boundary.
Yeah, the superior boundary is formed by the cystic artery, whereas there it is in hepatobiliary, it's the inferior surface of the liver. Okay, so we move on to the next team, Medzeppelin.
We're taking the honeycomb.
That's 6. Ready for your question?
Yes, Quizmaster.
So here we go.
Uh,
No answer. Okay, the answer is celiac plexus. And you guys lose it here. Okay, moving on to the next team. Humorous, guys.
Quizmaster will go for the bell.
That's set 5. So ready for your question?
Yeah.
Yes.
Today I read this somewhere.
Is it the port or something
What?
like?
It
It's going
surrounds
like,
the port hepatitis.
yeah.
No answer. That's quite disappointing. Okay, the answer is hilar plate.
Yeah, hilar.
Okay, the next team is Craving Cremaster.
Ma'am said 3, ma'am.
The honeybee one.
That honeycomb-like appearance is because of gallbladder with honeycomb-like appearance. A spiral valves of these there are.
Answer.
The deep diverticula gives honeycomb-like appearance, ma'am. In the neck, it forms spiral valve of Higgs there.
So, minus 25. Okay, the answer is incorrect. So, you're losing 25 points. The answer is Rokitansky-Askov sinuses. Moving on to the next team, we have Smarticus.
We'll go with that 1010.
Ready for your question?
Yes. Right hepatic duct, anterior sectoral branch. Right hepatic duct, right? No, ma'am, we don't know. No, we don't know.
It's the Lushka's duct. The next team, Porta Hepatis.
Quizmaster, the cycle.
Here's your question. Okay, the answer is double duct sign. No points for Porta Hepatis. Moving on to Trivus Abdominis, you're left with only one, which is erodent. Trivus Abdominis,
Yes, ma'am.
ready for your question?
Yes, ma'am. Yes, Quizmaster.
Okay.
We don't know.
None of the teams answered. Highly unexpected from this round. Okay, so the answer is pancreatic stellate cells. We were supposed to have a set of 5 questions after each. Okay, so we'll just go through these questions. Any team can answer.
Do we have points for lose them or just
No points. The round is over. Officially, semi-finals is done. This is just the sake of finishing it. Okay, so we'll go through the questions. Okay, we'll go by order then. Super Scrubs.
Yes, Quizmaster.
Yeah, give answers for
The
your
first
question.
one is peptic cells, neuroendocrine cells, gastric.
Quizmaster, third one, Renki
bodies, yeah.
Female urethra. What? Can she close பண்ணுங்க sir? Quizmaster, we can't see the question.
I think it's நம்ம இதுதானா இல்ல அவங்களோட
இல்ல சும்மா வெடி tell me to try.
Okay, the quiz is on hold. Just a minute. Okay, super scrubs. You can continue with the answering. Super scrubs.
Yes, quiz master. Wait, dash.
Okay, if you guys finish this quickly, we can see the results and okay, there's this time.
That's all. We don't know anything else, quiz master.
Only
we don't
one
know the
and
other
three.
questions. Only 1 and 3.
The answers are chief cells, onus nucleus, Reinke bodies, pudendal nerve, and retroinguinal space. Space of Bogros refers to retroinguinal space. Triumphant ride.
Yes, quiz master.
Your time starts now. You can answer whatever you know.
Ma'am, cremaster muscle is innervated by genitofemoral nerve.
Which branch?
Genital branch.
Yes. Time's up. Referred pain from gastroesophageal junction is felt at the lower retrosternal and subxiphoid area. The capacitance layer of the bladder is lamina propria. Cremaster muscle is innervated by the genital branch of genitofemoral nerve. Bartholin's glands are homologous to the bulbourethral gland. And the vascular membrane that covers the anterior surface of the ascending colon from the cecum to the right flexure that causes the bowel to kink is the Jackson's membrane. Med Zeppelin. Time starts now. You can answer these.
Ma'am, first one, gastroduodenal artery.
Right.
Number of arterial segment, 1, 2.
Third one is orchidopexy.
That's right.
Fourth one. Fourth one is superficial inguinal ring.
Ileocecal
The
fold.
inguinal canal.
Inferior ileocecal fold, ma'am. Fifth one.
That's absolutely right.
Fourth one is superficial inguinal ring.
Arterial branches of kidney are
1, 2, 3.
Okay, so you'll see the answers. The first one was right. Gastroduodenal artery. Number of arterial segments in kidney are 5. Surgical procedure to move ectopic testis into the scrotum is orchipexy. That was also right. The small oblique palmate folds called arbor vitae close which of the following structures by opposing its wall together? The answer for that is cervix. And ileocecal fold was also answered correctly. Moving on to next thing, humerus, guys.
So the second one is cuboidal.
Cuboidal epithelium.
Cuboidal.
Is it ciliated?
No, it's brush bordered cuboidal epithelium.
Okay, brush bordered.
Transtubercle plane is upper border of L5.
No, it's L3, no?
Transtubercular is upper 5. Subcostal is upper of L3.
Upper border of L5.
Okay.
Yeah. Transformation zone of the uterus, single and colonal.
That's L5. The answers are action of sympathetic system on jejunal and ileal vasculature is vasoconstriction. The epithelial lining of PCT is brush border cuboidal epithelium, and that was answered correctly. Verumontanum is the surgical landmark for urethral sphincter during transurethral resection for B, benign enlargement of prostate. At the transformation zone of the uterus, this columnar epithelium lining the endocervical canal changes to non-keratinized stratified squamous epithelium. And the transtubercular plane lies at the vertebral level of L5. Okay, so we move on to the next thing, craving cremasters. Here are your questions. Craving cremasters. No points allowed people.
Fifth one is spermatic fascia.
Third one is Scorpa amal. Third one is Scorpa amalish. That bodies.
Malaysia, that's right. Okay, the answers are mesoappendix is the triangular mesentery running between terminal ileum and appendix. The zone of suprarenal cortex that widens in pregnancy, zona fasciculata. Small colloidal amyloid bodies present in the prostatic follicles are the corpora amylaceae, which was answered correctly. Then following tissue regrowth after childbirth, at the vaginal end of the cervix, the aperture of the cervical mucosal gland may block and then fill with mucus to form mucocele. And the last one's internal spermatic fascia, the continuation of transversalis fascia. Okay, so next is smarticus. What are your questions?
Tinea aumentalis. Seminal vesicles. What form superior? Adrenal medulla, which plexus in front of anterior posterior, the prostatic anterior.
Okay, so we'll see the answers.
Hypogastric plexus.
Gastric plexus. The Santorini plexus. Okay, the tinea coli located posterolaterally is the tinea aumentalis. The area of the adrenal gland responsible for formation of new cortical cells is zona glomerulosa. Plexus in front, anterior of prostate gland is Santorini plexus. Gland opening on each side of the lateral margins of urethra, a skein of paraurethral glands. And the superior boundary of the superior lumbar triangle of Grinfeld is the 12th rib. So the next is for porta hepatis.
Extending with little ampulla and the sacrum is also known as a fascia. And the sacrum. The lateral border of the trigone contains the bladder.
Fascia of Valdier.
That's right.
Prostatic utricle, third one.
Yeah, that's right. Okay, that's the fascia of Valdier and sorry, the third one is incorrect in this. It's prostatic utricle. The Bell's muscle forms the lateral border for the trigone. No, in the lateral border of the trigone, the muscle fibers which are present are called the Bell's muscle. The steroid produced by the cells of theca interna during the process of maturation of the ovarian follicle is the androstenedium. Fusion fascia forming the avascular dissection plane to mobilize the duodenum and the head of pancreas is Street's fascia. Okay, the final set to trios abdominis.
First one is triads muscle. T10 is dermatome of umbilical region.
That's right. What's the organ of Rosen-Muller? What is it? Okay, that's epupheron, and Trades muscle was right. Submucosal muscle of the anal canal is also called as the Trades muscle, and brown lipos. The pigment aggregates are found in which layer of the adrenal? That's zona reticularis. Vasal artery is a branch of superior vesical artery. The organ of Rosen-Muller is a remnant of the mesonephric tubule, and the dermatome of the umbilical region is T10. Okay, so that's it. And the rapid fire round went really rapid. And all the questions that were displayed first were taken from only Grey's Anatomy and a special mention. So the results will be announced on. Okay, the results will be announced shortly. So here's a 5 minutes break. We'll be going for a 5 minutes break. Stop.
Inside me, son of a god. I'm like a titan that's rising, oh just you watch. I'm stepping into fate. There is no This is how legends are made. This is how legends are made. This is how legends are made. I've got that lightning inside me, son of a god. I'm like a titan that's rising, oh just you watch. I'm stepping into fate, there is no time to waste. I've got that lightning inside me. This is how legends are made. This is how legends are made. This is how legends are made. I've got that lightning inside me, son of a god. I'm like a titan that's rising, oh just you watch. I'm stepping into fate, there is no time to waste. I've got that lightning inside me. This is how legends are made. This is how legends are made. This is how legends are made.
So yeah, good evening, guys. So yeah, very good evening to one and all. And we have arrived at the most awaited moment, the semi-finals results. But before we go into it, let's start with our Instagram quiz contest results. Yeah. So here we go with the Instagram quiz contest results. The fifth place goes to Sri Raksha. The fourth place years. And now we'll go with our semi-finals results. The fourth team to enter is the humorous guys, Deepak B, Manasi Pillai Ashok, Japinder Singh, with the points 2000 to 80. The second runner-up of the semi-finals, here we go, the Mad Zeppelin, Devika A. Menon, Lakshya, and Veera Shakti V. The runner-up, the triumphant triads, Hamrish Kumar Rajkumar, Srinivas, and Kavya B, with the points 4,140. The winners, the Super Girls, the Super Scrubs, Sri Raksha, Srinupriya, and Vasantra, with points 4,415. And congratulations to all the winners and also the other teams too. And we are really amazed with your performance. And now we would like to hear a few words from our Associate Professor, Dr. Anjana ma'am.
Good evening, all of you.
Good evening, ma'am.
Congratulations to all the participants in the first place. And my best wishes to all of you, as I always say. Sincerely amazed by your performance, especially with regards to the clinical case scenarios, because most of it we couldn't even crack it, and you defied every logic we put forth to your seniors. I think you answered each and every question we thought you wouldn't answer, and you are, yeah. And the final round was from exactly, it is all from Grey's Anatomy. That is a testament to the level of training given by your seniors. So I'm seriously considering to look forward to do a study on this pure group teaching. I think it's better we start teaching from our faculty side. We let the seniors do the teaching here. Because anatomy yaar almost sollala the final round eppadi irundhuchu. How was that?
Yes.
But anyways, honestly amazed by your performances. Honestly, each and every one of you. Especially, it takes special knowledge or special, I should say, talent to crack the treasure hunt. And those contenders in Instagram, what is that? Meme contest, right? Special appreciation. Yes, yes, sir.
It's the Instagram quiz contest, ma'am.
Quiz contest, right?
Yes,
ma'am. So this is different from the meme, right?
Yes, ma'am.
Okay, okay. Special appreciations to you also, and all the best to the winners today. As I told you earlier, each and every one of you, you deserve a big round of applause, because the level of question, I didn't expect you to answer certain questions. As I told you earlier, you just defied every logic of our minds. And I've learned one thing, to not undermine undergraduate students' level of understanding. That, and I have learned a lot from your questions. But thank you to the senior batch students.
Thank you so much, ma'am.
All the best to the winners and best wishes to all the contenders today. Have a great time. Have a
Thank
great
you.
learning experience. All the best. All the best.
Thank you so much, ma'am. And we would like to hear a few words from our assistant professor, Dr. Shivaranjani, ma'am. I think ma'am is not available. Okay, so with all the wishes from other professors and HOD also congratulated you to all the participants, and she is in circumstance that she can't attend this, but it's fine. And now we would like to hear a few words from our team captains. The winning team captain, Raksha, please go ahead.
Ma'am, yeah, it was very fun, ma'am. I mean, we had a good time. It was like difficult when we were studying because there was so much to cover, and even like after we studied, we didn't know how to we didn't remember anything only, and then like we had to revise everything in the last 3 days. So it was very stressful. It was really really stressful, but I think it paid off. So yeah. But we just we didn't want we just didn't want to sort of we weren't thinking of going into finals or anything. We just wanted to do our best. That's all. This was pretty unexpected, but yeah. But we had
Anyways,
fun, man. Thank you.
keep going, captain. And the runner-up, Hamrish Kumar Rajkumar. Yeah, go ahead, captain.
Ma'am, I would like to begin by thanking my team members, first of all, because they made it all possible. When I entered this quiz, I just wanted to come in 8th place. That was all my expectation with which I came in. And coming up to second place, it was a really great task by both me and my teammates. We all, I felt like, okay, rather than doing something alone, it is.
Sorry to interrupt. Was that not in your wish list in this quiz? Come on. Huh?
Ma'am, could you please repeat?
You entered the quiz competition not wanting to win. Huh?
No, ma'am. Normally, I enter with an expectation, okay, I'm okay with being last so that I don't feel disappointed. So,
triumph and triumph.
So,
you should speak from your heart, right? You should speak for the audience here, Amrish. Always speak from your heart. Okay? It's okay if you're always wanting to win also. It is okay. You can speak your mind.
no, ma'am. That is not what I exactly have in mind.
Okay,
not
then,
to win always.
Okay, then. Okay. I agree. Agree with you, Amrish. Sorry to interrupt.
No, ma'am. And I also learned from this that rather than working alone, it actually makes a lot of difference working with a team. Everyone contributes something, and even when I was going through the text, I felt like, okay, people around me, they looked at it at a different angle and brought in points that I would have never even bothered to look at. So that was one thing which I learned from this, and looking forward to heavy competition for the finals.
That's nice to hear. And now the Medziplins captain, Devika. Yeah, go ahead.
A big shout out to my teammates, first of all. They were a huge support, ma'am. Instead of doing this alone, it felt comforting to have two people doing it along with you. And yeah, as Sriraksa said, there was a lot to study. So, but having three people sort of made it bearable a little bit. And a big shout out to the seniors who took classes for us also. It was a huge help. Thank you so much. And we noticed a lot of questions in the treasure hunt from the classes you took. So that helped too. And looking forward to the finals. We had a lot of fun in the semifinals, ma'am. So, thank you.
Thank you, Devika. And now the humorous guys captain, Deepak.
So, ma'am, it was a fun quiz. I just wanted to say big thank you to my teammates, because they answered almost all the questions. Because even I was frustrated in the treasure hunt round, and actually they did all the crosswords and helped the team. And Also, I wanted to thank your batch for having all those classes. It really helped us a lot. Thank you.
Thank you, Deepak. And next, we would like to hear the captain of Craving Masters, Janapriya.
I'd like to tell a big thank you for all the assistant professors and seniors, ma'am, for conducting this kind of quiz. We got a lot of exposure from this. We thoroughly enjoyed this quiz, ma'am. If this was not conducted, I would have stopped with just BDC. But because of this, I started reading Grace, Patho, Surgery. I learned a lot of new things from this, ma'am. I also like to thank my team members. They were so supportive. So thank you.
Thank you, Janapriya. And now, Akshaya.
Thank you, seniors, first of all, for conducting this quiz and making us to read standard books like Grace and everything like that. Otherwise, I would have stopped with Vishram Singh. And this was a very good learning experience for all of us, even my team members. We had a very good time in preparing for the quiz. Thank you.
Thank you, Smarticus. And now, captain of Kota Hepatis, Kirtana J.
Good evening, everyone, and thank you, seniors, first of all, because it's a great experience for us. We didn't even expect us coming to semi-final itself. We learned many things, first of all, new things, and team members, they helped us a lot. They even learned, on behalf of them, I thank you, everyone, because they learned everything through all the questions, and thank you, everyone.
Thank you, guys. And the team captain of Trials Abdominis, Harshvardhini.
First of all, thanks for my teammates and thank you for the second year seniors to organize this really great quiz program. And we did learn a lot of things, and we came out of bubble and tried very new things out of this quiz program. And thank you, guys.
Thank you, guys. And now, I would like to call our batchmate Suhail Ahmed to deliver the vote of thanks.
Yeah, very good evening to everyone. It gives me immense pleasure to do the vote of thanks for this event. On behalf of the entire batch of 2019, I would first like to thank our Dean, Dr. Jayanti ma'am, and the Vice Principal, Dr. Suganabai ma'am, for permitting us to do this extraordinary quiz. And also followed by Professor Dr. Tilagavadi ma'am, HOD of the Department of Anatomy, and Anjana ma'am, Associate Professor of the Department of Anatomy, for their constant support of this event. Next, also like to reach my thanks to the humble assistant professors, Dr. Brooklyn ma'am, Dr. Vahini ma'am, Dr. Shivaranjini ma'am, and of course, Dr. Taslima ma'am. We have been fortunate to have such excellent and dedicated faculties to help us cruise through this vastness of anatomy. And next, I'm very thankful to the batch of 2020 for their very eager participation and what do you say, their competitiveness. The semi-finalists also for their arduous effort to get to this stage. And last but not the least, of course, I would like to thank my batch of 2020, everything from the organizing committee to the question preparing committee, the creative team, the back-end team. A lot of effort has been put into it, all of which without them would be, this quiz would not have been possible. Yeah, and I would also like to take this opportunity to, on behalf of my batch, congratulate all the finalists. Wish you all the very best, and let's hope we'll keep challenging you like this. Thank you. Have a great day.
Thank you, Suhail, and thank you, everyone. And yes, we are winding off. We'll meet you guys in the finals of Galenoquest 2021. Bye.